Right, you're dispatched to Weber State University for a 22-year-old male fall victim.
Okay. BSI is my scene safe.
It is.
Okay. MOI is a fall. I have one patient. I'm going to call ALS, and sir, can I have you hold C-spine for me? I want you to hold his head just like this, just in line.
Okay.
Okay. Thank you. And sir, can you hear me? Sir, I'm going to try pain stimulus here. I get a moan. Do I hear any breathing?
No.
I'm going to open up his airway. Okay, he takes a breath.
What happened?
Sir, you fell. My name's Frank. I'm with Weber EMS. Is it okay if I help you?
Yeah.
Okay. He's talking to me now. I'm going to open up his airway and look into it. Sir, can you open up your... Do you feel around your mouth? Do you feel anything blocking your airway there?
No.
Okay. I'm going to put him on 15 liters per minute, non-rebreather. And I'm going to check his breathing now. Sir, take a deep breath for me. Okay, and out. Is that nice and easy?
Mm-hmm.
Okay. And now I'm going to check circulation. Going to feel a pulse. I feel a pulse. Strong and regular. His skin is pink, warm, and dry. And good cap refill. Looking over my patient, do I see any pools of blood?
On his right lower leg.
Okay. I'm going to do a quick assessment. Sorry. Tell me if I find any bleeding. Checking down his arms. Felt the pulse there. Checking down his arm here. And he has pulse. Checking down the thorax. Do I find any bleeding?
No.
Okay. Feeling the ribs. Quadrants, the pelvis. Feeling down his left leg. Any bleeding?
No.
Okay, and down his right.
Blood found?
Okay, I'm going to cut and expose, and I see a bleed. Is it venous or arterial?
Venous.
Okay. I'm going to put direct pressure, and before I bandage it, I'm going to check PMS. I feel a pulse. Sir, can you push down on my hand for me? Okay, and pull up. Do you feel what I'm doing?
Mm-hmm.
What am I doing?
Squeezing my toe.
Okay. With that, because it's a venous bleed, I'm going to do a spiral wrap. I've checked PMS before. Rolling on. Sir, do you have any allergies?
No.
Are you on any medications right now?
Mm-mm.
How about any medical history?
No, I'm pretty good.
Never passed out before or anything like that?
No.
Okay. When's the last time you ate?
Breakfast.
Breakfast? Okay. How long ago was that?
3 hours ago, 4 hours ago.
Okay. And what were you doing before you fell?
I was working on something on the ceiling.
Something on the ceiling? Okay. So that's about 4-foot fall. Okay. We are going to transport the patient now. Let me get some vitals. Heart rate of 64. And 14 respirations per minute. I'm going to get a quick blood pressure on my patient. So you're working on the ceiling?
Yeah.
Okay. Sir, did you see what happened?
I just saw him laying here on the floor and tried to wake him up, and he wouldn't wake up, so I got really scared and called 911.
Okay. Well, thanks for doing that. Okay. I've obliterated the pulse. Blood pressure is 116/80. We listen to lung sounds. Sir, take a deep breath for me. Okay. One more. Okay, lung sounds are clear and equal bilaterally. Check pupils. Sir, look at my nose for me. Okay, pupils are pearl. Check the nose and ears for CSF while I'm here. Okay, I've checked the neck for step-offs and JVD, deviated trachea. The trachea is midline. I'm going to put on a C-collar and transport my patient. Okay. There's that. Okay, this is to remind you not to move your head, okay? All right, now we're going to check his back. Bystander, on your count, we're going to roll him towards me.
1, 2, 3.
Okay. Now I'm going to cut and expose and feel down the spine, checking for any step-offs or any pain. Let me know if you feel any pain here, okay? And do I see any decap ETLS problems? Okay. And I'm feeling the rigidness of the ribs in the back here. Are they intact?
Yes.
Okay. Pulling the backboard. Bystander, on your count, we're going to roll him back down.
1, 2, 3.
Okay. All right. And up towards you on 3. 1, 2, 3. Okay. All right. Now I'm going to spider strap my patient. I'm going to secure at the chest, at the pelvis, above and below the knees, and then I'm going to secure the head.
Consider it done.
Copy. Okay, we are now in transport, and I am going to now. Oh, you can go ahead and let go of C-spine. Have him on a head bed. Thank you. I'm now going to do a detailed physical exam. Sir, you let me know if you feel any pain, okay?
Mm-hmm.
Okay, I'm feeling the scalp, cranial bones, they're intact. Checking the orbits, on the nose, mandible and the maxilla. I've already checked inside the mouth, and I've checked the neck for decap, VTLS, JVD, deviated trachea. Checking the shoulders and the collarbones, long bones. And while I'm doing this, I'm cutting and exposing as I go. Checking the sternum. Take a deep breath in for me. Okay, and out. Okay, ribs are intact. And check the 4 quadrants. Tell me if you feel any pain, okay? And rebound tenderness. Okay, I'm going to check PMS in the arms. Squeeze my hands for me. Okay, squeezes are equal. I have bilateral pulses. Can you tell me what I'm doing?
Rubbing my thumb.
Which thumb?
Left.
And what am I doing now?
Rubbing my finger. Index finger.
Okay. All right, I've checked the pelvis. I do not feel the need to check the genitalia at this time. Now checking long bones. Cut exposing. Checking for decap ETLS. For the short bone, I'm going to check the integrity of this bandage. Be sure that he's not bleeding through or anything like that. I'm going to check bilateral pulses on the feet. I feel pulses. Sir, can you push down against my hands for me and pull up? Okay. Do you feel what I'm doing to you?
Yeah, squeezing my toes.
Okay. All right. I am now going to call the hospital, let them know what I have, and I'm going to do an ongoing assessment. And I'm going to reassess vitals. So,
Vitals at this time, our pulse is 110, respirations are at 20, BP is at 100 over palp.
okay, my patient is going into shock. I'm going to put on a blanket, keep him warm. I'm going to elevate his legs.
Your neck. So I just need you to point your chin to your chest and back to the side, to the other side, and then rotate your neck. Okay, and I'll just have you turn your neck again to this way, and then push against my hand, and the other way. Okay, muscle grade 5, 4-inch motion in the neck. Now we're going to move down to your arms. So I just need you to raise your arms, go in a full circle, and back. Okay, and then put your arms behind your head. Okay, and then can you rotate your wrists? Okay, so you have full range of motion of the shoulders, the elbows, and the wrists. And I'm going to go ahead and grade your muscle strength in one of your arms. So just flex for me. And I'm going to apply some opposing force. Okay, push against. Muscle grade 5 in the arms. Okay, now we're going to move down to fine motor. So just touch your fingers to your thumb in reverse order. Okay, now flip your wrist back and forth. So fine motor is intact. Now we're going to move down to the spine. So I just need you to tilt forward and back to the side, to the other side, and then rotate both ways. Okay, now I'm going to have you bend forward again. I'm going to go ahead and check your spine. You have any tenderness? No. Okay, so spine is midline with no tenderness. You can go ahead and stand up. Okay, now we're going to move down to your legs. So just bring one leg up and rotate it out. Okay, point your toe, flex your heel back, like a full circle. So a full range of motion of the hip, the knee, and then can you rotate your ankle in a circle for me? Okay, and the ankle. So now I'm going to grade your muscles in your leg. So just raise your knee for me. I'm going to push down. Okay, and then, okay, muscle grade 5 in the legs. I would test that bilaterally. All right, so now I'm going to do, the last thing I'm going to do before I have you sit down is the Romberg test. It's a test of balance. So I just need you to stand there with your eyes closed for 20 seconds. I'm going to hold my arms out to the side to check for swaying. Okay, so negative Romberg for 20 seconds. You can go ahead and have a seat. Okay, so I'm just going to start head to toe now, starting with your skin. Your skin is pink, moist, and warm. Now I'm going to move to your head. I'm just going to feel for a second. So your head is normocephalic. No masses or lesions are present. Hair is evenly distributed. You have good control of your head. Okay. So now I'm going to palpate your temporal artery. 2+. I'm going to feel for your temporomandibular joint. So just open your jaw for me. Okay, no TMJ present. No popping of the joint. And can you clench your jaw for me? Okay, cranial nerve 5 is intact. Now I'm going to palpate your sinuses. This is your maxillary. Tell me if you have any tenderness. And your frontal. Okay. So now I'm going to move down. I'm going to check for bilateral equal movement of your facial expressions when you change your facial expressions. So can you smile and frown and puff out your cheeks? Okay, so cranial nerve 7 is intact. Now I'm going to move to your eyes. Your eyes, your external structures are intact. Eyebrows and eyelashes are present. No lesions or drainage noted. I'm going to inspect your conjunctiva. Conjunctiva is pink and moist. Your sclera is white. Now I'm going to go ahead and grade your pupils. So your pupils are round, regular, and 3 millimeters bilaterally. Okay. Now we're going to do direct consensual response to light, which means that while one pupil constricts to light, the other should also at the same time. So direct and consensual. Cranial nerve 3 is intact. Now I'm going to test for accommodation, which means when you look at something in the distance, your pupils should dilate. When you focus on something up close, they should constrict. So if you can, just focus on the Snellen chart for a second for me. Okay, and now look at my pen light. Okay, cranial nerve 3 is intact. Now we're going to do the 6 cardinal gazes of vision. I just need you to follow my pen light with your eyes only. this just tests for your extraocular eye movement. Cranial nerves 3, 4, and 6 are intact. Now we're going to do the cover test. So I just need you to cover one eye with an opaque card and focus on my nose. Okay, so you have a steady fixed gaze in your uncovered eye. You can go ahead and remove. Okay, and you have a steady fixed gaze in your other eye. If your eye jumped back to fixate, then you would have eye weakness, which you don't. Now we're going to test the red reflex. It's the last thing we'll do in the eye. Okay, red reflex is present, and I would test that bilaterally. Go ahead and get this set up for the ear. Okay, so now I'm going to move to your ears. Your ears are symmetrical in location. Do you have any tenderness when I palpate? No. No. Okay, now I test that bilaterally. No drainage or lesions noted. So now I'm going to go ahead and take a look in your ear. Tympanic membrane is clearly gray and translucent. The canal is clear, and I would check that bilaterally. Okay, so now we're going to do the whispered voice test. So I just need you to cover one ear, and I'm going to go behind you and say a word and have you repeat it. Okay. Cranial nerve 8 is intact, and I would test that bilaterally. Now we're going to do the Weber and Rhine test. With the Weber test, I'm going to place the tuning fork in the middle of your skull. You should hear the tone equally in both ears. If you don't, let me know. Okay. So Weber test is midline with no lateralizations. Now I'm going to do the Rhine test, which is a test of bone conduction versus air conduction. We hear better through air. I'm going to place the tuning fork on your mastoid process. When you stop hearing it, let me know. Rotate it to the front, and then you also let me know when you stop hearing it. Okay, so AC to BC is a 2-to-1 ratio. Okay, so now I'm going to move down to your nose. Your nose is symmetrical and midline. I'm going to take a look here. Non-deviated septum. Mucosa is pink and moist. Turbinates are present but not inflamed. Okay, we're going to check the patency of your nostrils, so just cover one sniff and the other. Okay, so nares are patent. Now we're going to do the sniff test, or the smell test. Okay, so just close your eyes and tell me what you smell. Okay, cranial nerve 1 is intact. Okay, we're going to move down to the mouth now. Your lips are pink and moist. And I'll go ahead and have you open your mouth now. Okay, so buccal mucosa is pink and moist. Tongue is pink and even. Can you raise your tongue up for me? The floor of the mouth is glossy. Okay, and I'm going to count the number of teeth and their repair. Go ahead and lower your tongue for me. Okay, so tonsils are a grade 1. Soft and hard palate is intact. You stick your tongue out for me and say ah. Okay, cranial nerve 12 is intact. Uvula moves midline upon phonation. Tongue protrudes midline. Okay, can you go ahead and swallow for me? Okay, cranial nerves 9 and 10 are intact. Now I'm going to move down to your neck now. Your neck is symmetrical, no masses or lesions present. You can turn your head for me. Okay, no jugular vein distension. I'm going to palpate your carotid artery. Okay, 2+. Now we'll grade that bilaterally, one at a time. Now I'm going to go behind you and palpate your thyroid and your trachea. Okay, so your trachea is midline. I'm going to displace your thyroid and have you swallow. Okay, so thyroid non-palpable. Okay, so now I'm going to feel for your lymph nodes. This is preauricular, postauricular, occipital, jugulodigastric, submandibular, submental, superficial cervical, posterior cervical, deep cervical chain, supraclavicular, palpate your epitrochlear nodes. I would check those all bilaterally. And I'm going to check your inguinal nodes whenever I have you lay down here in a second. Okay, so now I'm going to move down to your chest. Your chest appears to be symmetrical. I don't see any masses or lesions. Now I'm going to check for symmetrical expansion of your thoracic cage when you breathe. Just take a breath for me. I'm just going to go over here posteriorly. Okay, so thoracic cage is symmetrical upon breathing. Now I'm going to listen for your breath sounds. Have you turn this way a little bit? Okay. One, two, two, three. Now I displace the breaths. Four, five. Turn around posteriorly. One, two, three, four, five, six, seven, eight, nine. So lung sounds are clear, no adventitious lung sounds. Now I'm going to listen to your heart. Your right second intercostal space is your aortic valve. Your second left intercostal space is your pulmonic valve. Third intercostal space is Erb's point. Lower left sternal border is that tricuspid valve. The fifth midclavicular line is the apical pulse, the mitral valve. I would listen here for 1 minute for the apical pulse. S1, S2 noted, no murmurs, no abnormal sounds. Okay. All right, so now I'm going to move to your upper extremities. Can you go ahead and shrug your shoulders for me? Okay, cranial nerve 11 is intact. So now look at your arms here. Your arms are symmetric. Skin is pink, moist, and warm. Do you have any tenderness or anything in your arms? Okay, so I'm going to go ahead and feel for all of your pulses at this point. This is your brachial pulse, 2+, your radial pulse, 2+, and I'm going to feel for your femoral pulse whenever I have you lay down. Popliteal pulse, 2+, dorsalis pedis pulse, 2+, posterior tibial, 2+. Now I would check those all bilaterally. Okay, so now I'm going to go ahead and elicit all your reflexes at this time, starting with the tricep reflex. So just relax your arm. Two plus. This is the bicep reflex. 2+. Brachioradialis. 2+. Quadricep reflex. 2+. Achilles. 2+. Implantar. No Babinski sign. Now I'm going to check the sensory in your upper extremities. So just let me know if you feel soft or light touch, or sharp and soft touch, I'm sorry. Okay, so just close your eyes. Okay, so sensory is intact in the upper extremities. I would check that bilaterally. Okay, so now I'm going to move down to your abdomen, so you can go ahead and lay down. Okay, so I'm going to check the contour of the stomach. I'm going to check for any distension. I'm going to check for symmetry symmetry of the stomach. So the stomach is flat and symmetrical. I would check the location of the umbilicus and for any pulsations. I'm going to start listening to the vowel sounds in the right lower quadrant. Right upper, left upper, and left lower. So normal vowel sounds present. If there were absent vowel sounds, then I would listen for 5 minutes in each quadrant. Now I'm going to feel for the femoral pulse. 2+, and then I'll palpate for your inguinal nodes, which are non-palpable. Okay, so you can go ahead and set it for me. I'm going to move down to the legs. Legs are symmetrical. Skin is pink, warm, and moist. No edema is present. You don't have any like hair. If you were a man, then I would check for symmetrical, evenly distributed hair. And now I'm going to check for your sensory in your legs. So just close your eyes and we'll test for sharp and light touch. Okay, so sensory is intact, and I would check that bilateral.